Good morning, I'm Amy Lynn. It's an uncomfortable subject, but it's important for all men to be aware about. And here to talk about signs and symptoms of enlarged prostate is Dr. Scott Caesar from University Urology. Good morning, my friend.
Good morning, how are you?
You know, they're lucky that we're here to do the uncomfortable talking, right?
It's what I love to do.
It shouldn't be taboo. I really think if more people come out and talk about the taboo subjects, then more people will actually get the care that they need.
Yeah, you know, prostate issues is probably the most common reason that I see patients in the office, men in the office. And once you kind of realize what you're looking for, it becomes pretty easy to talk about and then easy to fix.
Okay, so let's talk about the symptoms of an enlarged prostate. What are these guys having?
So usually guys are coming to the office complaining about a bunch of things. Getting up at night to pee a lot,
Right.
a slow flow, stopping and starting, not getting everything out, feeling like they have to go to the bathroom all the time. So a lot of things that bug them about something that should be easy to do.
Okay, so now guys try medications, right?
Yeah, so a lot of times when urologists see a patient, a primary doctor's already kind of listened to their problems and tried a couple medications like Flomax or tamsulosin or finasteride. These are common medications that can try and open up the prostate or shrink it to help them urinate better. But those medications have about a 50% success rate. So half the time it's a coin flip to see if, you know, they're actually gonna help you. So when that happens, you see a urologist who can talk to you about, well, if medications aren't working, there are a bunch of other things that are available to you to try and help.
Okay, so can we talk about some of those things that are available?
Yeah, sure. So a lot of the procedures now to help people with enlarged prostates are actually pretty minimally invasive. A lot of them are outpatient procedures. Some can be done in the office. A lot of them involve moving the prostate out of the way. So the prostate kind of impinges upon the urethra, which is the tube that you pee out of. So when it starts growing, it kind of closes on the urethra. So a lot of the treatments that urologists do in order to fix that are either to remove the actual obstruction by actually removing some of the prostate that's actually compressing on the urethra. There's also procedures that can just move them out of the way to have guys pee better. So the ultimate goal when urologists fix this problem is to remove the obstruction to let the urine flow freely to get out of the bladder.
Okay, so of all the options, what is the easiest?
Well, the easiest answer to that is whatever urologist is most comfortable doing. There are a bunch of different ways to do the procedure. One of the most common ways urologists have been doing it for many years is something called a TURP, or resection of the prostate. That's actually, you know, cutting out most of the prostate. A lot of the newer technologies make that a lot easier to do. There's a laser you can use to actually vaporize the inside of it, so there's a lot less bleeding that actually debulks the inside of the prostate.
You are a plethora of information, Scott. Thank you so much for coming on this morning.
No problem, it was great to be here.
This guy knows his stuff, so if you want to get more information so you can talk to Scott, go to our website, fox4morningblend.com.